Did you know that there are 3 different ways a nurse can take a patient's blood pressure? What's up guys, and welcome back to the channel. In this video, we will be discussing 3 different medical techniques used to acquire a patient's blood pressure. Now, there are many different reasons why each of these methods may be chosen to utilize on a specific patient, so stay tuned. First and foremost, thank you to everyone watching. I want to send out a big shout out to all of my recent subscribers. Y'all, we have hit 250 subs. That is amazing. Thank you so much. If you're not subscribed, please consider subscribing. It really helps me out, and I want to continue to provide you all with the best content possible. So without further ado, let's get right into the video. Okay, so the first technique we will be discussing is the manual non-invasive blood pressure. This is known as the direct auscultation method. This involves using a stethoscope and inflating this pressure cuff in order to test the pressure of the brachial artery. This is a technique known as the Kortikoff method. You place the cuff around the patient and inflate to around 180 to 200 millimeters of mercury. Then you will place your stethoscope on the patient's brachial artery and listen to the pulse sounds. The pressure in the cuff will slowly decrease. When you hear the first pulse sound, that is your systolic measurement. And when you hear the last pulse sound, that is your diastolic measurement. The truth is that this technique is slightly outdated due to all of the advances in medical technology, but there are still 2 reasons why you might want to use this method. Number 1, in the cardiac world, there is a device known as the LVAD. This is a device that helps the patient's heart pump harder. Since this device is synthetically helping the blood to flow, it will interfere with more advanced traditional automatic technology, and thus the manual method is the preferred way to check the blood pressure. The number 2 reason why you might want to use the manual method is a situation where A, the medical technology is not working or has malfunctioned, or the reading is outside the normal parameters, and a second method of verification is warranted to make sure that this is in fact an accurate blood pressure. Okay, the second and the most popular way to take a patient's blood pressure is by using an automatic blood pressure cuff like this one. Here's how the automatic cuff works. Cuff inflation. The process begins by placing an inflatable cuff on the upper arm or wrist of a patient. You should place the cuff with the arrow facing down just above the artery of intended use. Then hit start on the monitor. Pressure deflation. As the cuff slowly deflates, the monitor detects the pulses in the arterial wall, indicating the upper range, the systolic, and the lower range, the diastolic. The monitor then uses a sophisticated algorithm to analyze the amplitude and frequency of these oscillations in the artery. It identifies specific pressure points associated with the onset and cessation of these oscillations. These points correspond again to the systolic and the diastolic, as well as a mean arterial pressure. Once the algorithm has calculated everything, the monitor will show you the ranges and the map. Advantages of using an automatic cuff include that it's non-invasive and it's quick and convenient. No stethoscope or medical training is required. It's a wide availability and settings are using it. Hospitals, clinics, and even in the home care and at-home setting. That's another reason why it's one of the most popular methods, is because you can buy one of these at CVS and take your own blood pressure without much skill required. These monitors also have a range of cycle settings that can make it very convenient for the nurse in an inpatient setting. For example, the nurse can set this to take every 15 to 30 minutes in order to gather a trend of the patient's vitals without having to go in the room every 15 to 30 minutes, because this will take automatically. Now, one of the downsides of that, however, is that if the patient is moving or if it doesn't have a good grip around the arm, it may not be the most accurate measure. Although this method is essentially the gold standard and widely used across the hospital setting, however, it does come with potential downfalls. First of which, it must be snug on the patient's wrist or brachial artery to make sure proper placement. And second, if the patient's moving, it may provide you with a reading that is inaccurate. So in order to trend proper blood pressures, make sure adequate placement and also make sure that the patient is lying as still as possible. Okay, the last and final method of how to take a blood pressure is by using something known as an arterial line. An arterial line is also known as an arterial catheter, is an IV thin, flexible port that will go into the patient's artery. It can either go into the brachial artery or the radial artery, and sometimes they'll even do femoral artery. It is commonly used in critical care settings such as the emergency department or the ICU. However, they may also be seen in the step-down units as well. Here's how an arterial blood pressure works. The first step is insertion. A qualified healthcare provider, often a physician or specially trained CRNA or nurse, will insert the arterial line into the selected artery. The most common insertion site, again, is going to be the radial artery or the femoral groin or sometimes the brachial artery. Once the line is in place, the physician will suture it down and place a sterile dressing over it to secure it and keep it infection-free. Next, a sensor known as a transducer is attached via lure lock fashion to the catheter. This sensor's job is to continually monitor the patient's blood pressure by picking up on the flow and the blood flow within the artery. Advantages of arterial lines for blood pressure monitoring. First off, continuous monitoring. Arterial lines provide real-time and continuous blood pressure trends, allowing healthcare providers to quickly detect changes and respond accordingly. Arterial lines offer highly accurate and reliable blood pressure readings, especially in the critically ill patients with fluctuating blood pressure measurements. The second benefit of arterial lines is that it can provide you a site where you can do frequent blood sampling. This includes attaching a syringe and getting blood from the patient to monitor their hemoglobin, potassium, and other labs that you might draw frequently on an ICU patient. Another benefit is that it reduces the disruption by having to continually place the blood pressure cuff on the patient. Because once the arterial line is in place, there is no need for repeated cuff inflation and deflation. This can be disruptive in patients, especially those who are critically ill or unstable. It's very important to note that insertion and maintenance of an arterial line requires specialized training and careful attention to hygiene, infection control, and preventing complications such as infection, bleeding, or damage to the artery. Arterial lines are commonly used in patients with severe medical conditions where the benefits outweigh the risks of these lines. And there you have it, a comprehensive overview of the different techniques for measuring blood pressure in nursing. Remember, each method has its advantages and considerations, and practice is key in mastering them. Keep honing in your skills to ensure that you provide the best possible care to your patients. If you found this video helpful, give it a thumbs up and subscribe for more nursing insights and tutorials. Don't hesitate to ask any questions or suggestions in the comments below. Thanks for joining us, and until the next one, I wish you health, wealth, and happiness. Adios.